today's message.
Good morning. My name is Ralf Friedrichs. I am an author, an addiction recovery coach, a life coach, and host of this show, to Take Your Life Back Today radio show. You can see a video version of this on YouTube on their channel, Take Your Life Back Today show. Coronavirus, stress and coping with it. The outbreak of coronavirus disease, COVID-19, may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you or break you, the people you care about, and your community, and it can make you also stronger. Everyone reacts differently to stress situations. How you respond to the outbreak can depend on your background, the things that make you different from other people, and the community that you live in. People who may respond more strongly to stress of a crisis include older people and people with chronic diseases who are at higher risk for COVID-19. Children and teens, my friends. People who are helping with the response to COVID-19, like doctors and other health care providers, or first responders. People who have mental health conditions, including problems with substance use. If you or someone you care about are feeling overwhelmed with the emotions like sadness, depression, or anxiety, or feel like you want to harm yourself or others, call 844-405-HELP and talk to me directly, or call 911. Substance Abuse and Mental Health Services Administration Disaster Distress Helpline, or at 1-800-985-5990. Stress during an infectious disease outbreak can include fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, my friends, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. People with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. Additional information can be found at the Substance Abuse and Mental Health Service Administration. Taking care of yourself, my friends, and taking care of your friends and your family can help you cope with stress. Helping others cope with their stress can also make your community stronger. Things you can do to support yourself. Take breaks from watching, reading, or listening to the news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Make time to unwind. Try to do some other activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling this morning or during the day. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. Reduce stress in yourself and in other people around you. Sharing the facts about COVID-19, otherwise known as coronavirus, and understanding the actual risk to yourself and people you care about can make the outbreak less stressful. When you share accurate information about coronavirus, you can help make people feel less stressed and allow you to connect with them. For the parents watching me, children and teens react in part on what they see from the adults around them. When parents and caregivers deal with coronavirus calmly and confidentially, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. Not all children and teens respond to stress in the same way. Some common changes to watch for include the following: excessive crying or irritation in younger children, returning to behaviors they have outgrown, for an example, toileting, accidents, or bedwetting, excessive worry or sadness, unhealthy eating or sleeping habits, irritability and acting out behaviors in teens, poor school performance or avoiding school totally, difficulty with attention and concentration spans, avoidance of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol and tobacco or other drugs. There are many things you can do to support your child. Take time to talk with your child or your teen about coronavirus outbreak. Answer questions when asked and share facts about the coronavirus in a way that your child or teen can understand. Don't try to use too many big words. Reassure your child or your teen that they are safe. Let them know it's okay if they feel upset. Share with them how you deal with your own stress so that they can learn how to cope from you. Friends, limit your family's exposure to news. I urge you. News coverage of this event, including social media, can alarm people. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with regular routines. If schools are closed, create a schedule for learning activities and relaxing or fun activities at home. Be a role model. Take breaks. Get plenty of sleep, exercise, and eat well. Connect with your friends and family members throughout the day. Learn more about helping children cope. For responders, responding to coronavirus can take an emotional toll on you as well. There are things that you can do to reduce secondary traumatic stress, STS, reactions. Acknowledge that STS can impact anyone helping families after a traumatic event. Learn the symptoms including physical, fatigue, illness, and mental fear, withdrawal, guilt. Allow time for you and your family to recover from responding to the pandemic. Create a menu of personal self-care activities that you enjoy, such as spending time with friends and family, exercising, or reading a book. Maybe even read one of my books. Take a break from media coverage of the coronavirus. Sometimes that is not good to do, to overwatch that. Ask for help if you feel overwhelmed, concerned that the coronavirus is affecting your ability to care for your family and patients as you did before the outbreak. Learn more tips for taking care of yourself during the emergency response crisis. For people who have been released from quarantine, being separated from others, if a healthcare provider thinks you may have been exposed to the coronavirus, can be stressful, even if you do not get sick. Everyone feels differently after coming out of quarantine. Some feelings include the following: mixed emotions, including relief after quarantine, fear and worry about your own health and the health of your loved ones, stress from experience of monitoring yourself or being monitored by others for signs and symptoms of the coronavirus, sadness, anger, or frustration because friends or loved ones have unfounded fears of contacting the disease from contact with you, even though you have been determined not to be contagious. Guilt about not being able to perform normal work or parenting duties during quarantine isolation. Other emotional or mental health changes can include children may also feel upset or have other strong emotions if they or someone they know has been released from quarantine. You can help your child cope. Friends, call me at 844-405-HELP. Together we can help each other take our lives back. Coronavirus is not an isolated thing. This is throughout the world right now. We need all show compassion and empathy towards each other and act like human beings. May God bless you. Call me if you have any questions. Call 911 if you feel that there is issues going on immediately. God loves you. God will protect us. Reach out to God for guidance and direction immediately and take good care